Good evening, colleagues, ladies and gentlemen. First of all, may I congratulate and thank the Philippine Society of Otolaryngology Head and Neck Surgery and the Philippine Academy of the Craniomaxillofacial Surgery for having me tonight. The past, or knowing where we came from, is always something we value most because it gives and inspires us in continuing the wisdom and legacy on why things came about from those who initiated and established it. For the ENT craniomaxillofacial surgery, I believe that its ORL-HNS training institution has its own story to tell on the development of their departmental craniomaxillofacial subspecialty in relation to the advent or the birth of the Philippine Academy of Craniomaxillofacial Surgery, PSO-HNS. Sharing with you in this slide the perspective of this Avenue Medical Center, ORL-HNS, and on 4 years, along with other institutions, leader in the development of ENT maxillofacial trauma surgery, with many maxillofacial trauma patients being a big 1,000-bed government medical center with 24 ENT residents offering 4 major and minor ORL subspecialty fellowship programs with almost 40 to 50 active and affiliated consultants on the departmental level in a very strategic location. In late 1989, after arriving from England, from preceptorial training in oncology, head and neck surgery, and laser surgery, I noted that we had a lot of maxillofacial trauma patients in the department that demanded high quality management and service. This inspired me to have additional fellowship training in 1993 in Detroit Medical Center, Wayne State University, under Professor Robert Mayfield, who was known for maxillofacial trauma plastic ENT surgeon, of whom many of us benefited from his 3 books in maxillofacial trauma surgery, but he did not let me go unless I finished a required research paper at the same time. Luckily, I did, and it was accepted as one of the 10 international papers for oral presentation at the American Academy of ORL-HNS annual convention in 1994, and was subsequently published in the Journal of April 1995. When he gave me his favorite award-winning book, sabi niya, masipag daw mga Pilipino, and he said to me, send more Filipino fellows. But then, unfortunately, the interest of the residents in the subspecialty scene is still in its infancy period. Nonetheless, later, as more ENT fellows and residents develop more interest in the advent of plating or rigid fixation in their respective institution, and as we trail the road toward the rise of the PSO-HNS interest groups, from the wire fixation, we encountered the stainless steel plating, the Italian plating system, and of course, the best of them all, the titanium plating. Some pictures of the many conferences and postgrad courses in some of the training institutions. The consultants together for posterity after a day's work. As early as year 2002, there were several members of the PSO-HNS with ardent interest and vision the organization of the maxillofacial surgery study group. This was initiated and realized by the formation of the JEDI by 2 hospitals with common maxillofacial consultants, where regular monthly meetings with residents and consultants, members of the PSO-HNS, were held in compliance with the requirement of the subspecialty group of our society. With Dr. DocLouie, Dr. Magnon, yours truly, and others, we were common in both of the hospitals. And I guess we were inspired by the wisdom of the Jedi during the heyday of the Star Wars movies. So we came up with the Jose Reyes and East Avenue didactic instruction to enhance our wisdom in the practice of maxillofacial surgery as well. On March 22, year 2004, the formal organization meeting of for the maxillofacial study group named Philippine Academy of Maxillofacial Surgery, PSO-HNS, was held in Capilla Restaurant Greenbelt 4, Makati, with the following members of the boards, yours truly with Vice President Dr. Pangan and the rest of the hospitals. In the year 2005, it was decided that the Philippine Academy of Facial Plastic and Reconstructive Surgery will be the counterpart of the American Academy of Facial Plastic and Reconstructive Surgery. Hence, the PACMFS will represent internationally the three subspecialties of cosmetic surgery, maxillofacial surgery, and plastic and reconstructive surgery as a united front to harmonize with the American Academy of Facial Plastic and Reconstructive Surgery. However, locally, the three subspecialties with the respective heads will be working independently in representing itself in relation to the local counterpart organization. In September 17, year 2008, the Philippine Academy of Maxillofacial Surgery final name became the Philippine Academy of Craniomaxillofacial Surgery with a new logo courtesy of Dr. Louis Gutierrez, and it became totally independent from the Philippine Academy of Facial Plastic and Reconstructive Surgery, or PACMFS. While FACES, the Facial Aesthetic Corps of ENT Surgeons, incorporated itself and became independent, but will never cut its umbilical cord from the PSO-HNS. In 2010, we had the changing of the guards. As I ended my term after 6 years as founding president and chairman, we were glad to have Dr. Ferdinand Pamintuan and other officers then leading the group. In 2013, the Academy officers was led by Dr. Joselito David, president. The present officers of the Academy with Dr. Enrico Donato as presidents since 2017. Our appreciation to our colleagues who have participated in the promotion of the AO philosophy in maxillofacial surgery and conducting many AO workshops. Through the years, the four presidents of the Philippine Academy of Craniomaxillofacial Surgery and chairman of the Inter-Study Group, PSO-HNS, despite the busy private practice of the members, were able to live up with the expectations of the Academy, going around the country to promote and support the conferences and workshop, enhancement of researches, formulation of CPGs, among others, in the spirit of education and better treatment to our patients. Well, some available memorable pictures during those times. Smiling faces for good achievements, and sometimes serious talk. Some of the advances, one of which is the destruction osteogenesis, where Dr. Joselito David has done many cases in his academy. The computer-assisted maxillofacial surgery, stereolithography, the medical additive printing that we have there, Dr. Gutierrez. Of course, a sample output of the system. Since time immemorial, there has been an on and off surge of interest in maxillofacial surgery with the above other specialties. But the ENT surgeons always remain steadfast, as whether he likes it or not, he is always in the area of the head and neck. Hence, the subspecialist ENT surgeons said no way but to accept the challenge and lead in the advancement of the development of the subspecialty for better service to the patients. Having a building structure or an edifice that will represent or stand for the symbol of our spearheading in maxillofacial surgery is most valuable and something to be most desired. In this slide, the ENT East Avenue Medical Center had this vision of building an edifice for otolaryngologic maxillofacial surgery. It took more than 15 years, starting from the concept and about 5 medical directors, but we made it through the great and vital efforts of Medical Center Chief Dr. Roland Cortez, looking for funding for more than 5 years, as he believed in subspecialty services for East Avenue, starting in the Eye Center and the DOH Skin Center. In the beginning of the vision, the department was very lucky to have Dr. Roberto Pangan, Dr. Joey La Peña, and Dr. Armando Chong Jr., who to accept our invitation to come to East Avenue Medical Center for this endeavor. We were at the same time all consultants at the UPPGH then, where we were learning a lot from our high caliber, super trained young mentor then, the great Dr. Octavio Ibarra Jr. And in that period, Dr. Joselito David, another silently hardworking maxillofacial surgeon, joined us too in East Avenue Medical Center as the journey has begun. The beginnings of the construction with Dr. Gutierrez, always spearheading in the site area. The construction of the otolaryngologic maxillofacial aesthetic surgery center took many years, but we at the Department of ORL HNS were relentless in the pursuit of its realization, no matter when it be. And true enough, OMAC took 7 years in the making, but it was a great and unique work. With this development, the residents or graduates were inspired that there's a great future in maxillofacial surgery. I thank the craniomaxillofacial plastic consultants, Dr. Pangan, Dr. La Peña, Dr. Bid, Dr. Chong, yours truly, whom and others and other consultants whom I believe in one way or another inspired the ENT graduates to pursue the AO 3-month fellowship program and the PACES 2 years fellowship program that strengthened the department and eventually the Philippine Academy of Maxillofacial Surgery. East Avenue Medical Center graduates with PACES fellowship as well, and the aesthetic section of the OMAC being spearheaded by Dr. Conrad Aguila of the Philippine Society of Cosmetic Surgery, and of course, our famous Dr. Ed Yap of PACES. The plastic and reconstructive surgery is now being developed by Armando Chong Jr. Through the years of hard work in 2014, the East Avenue ENT was granted by Medical Center Chief Dr. Roland Cortez 2 fellowship items, each for maxillofacial surgery, otology, head and neck surgery, and rhinology. We already have 3 batches of fellows graduate in all of the subspecialties. And for maxillofacial surgery, our first was Dr. Anueli Acluba Pawig. She finished in 2017 with a 3-month fellowship abroad rotation in Cantos Hospital, Lucerne, Switzerland, through the courtesy of Dr. Pangan as part of the OMAC Fellowship Program. OMAC second maxillofacial fellow, Dr. Arlan Artura, basically finished in 2020, and our present fellow now is Dr. Nika Yang. The DOH-OMAC Fellowship Training Program. The craniofacial surgery is active with 2 graduates and 1 in training. The plastic and reconstructive surgery is in process. The facial aesthetic surgery in process. There is no cranio-maxillofacial surgery CMS fellowship training program nor fellowship training consortium by the Philippine Academy of Cranio-Maxillofacial Surgery, as clarified and announced by its president and chairman, Dr. Enrico Donato. Although other institutions are also starting to establish their own fellowship program. The Philippine Academy of Maxillofacial Surgery is sponsoring joint conferences among the fellows. And this is the recently approved DOH-OMAC East Avenue Medical Center Fellowship Training Committee, headed by Dr. Renario Almonte. Of course, our past training officer, Dr. Rosalito. The DOH-OMAC, being under the national government, with all its support, has all the potential to bring Philippine Academy of Cranio-Maxillofacial Surgery to its greatest heights in itself and in relation to the other specialties with common interests. DOH-OMAC East Avenue is envisioned to be the endpoint of referral center of the DOH regional hospitals in the whole country. It could serve as the edifice or structural symbol of our subspecialty that is also in the interest of other specialties, where we look forward for a positive, collaborative work to give better service to our patients. We could also serve and host the initial office of the Philippine Academy of Cranio-Maxillofacial Surgery for the time being. And also, it could serve as an arena or a venue for collaborative endeavors with AO and other organizations in the advancement of the cranio-maxillofacial surgery. Realizing the great potential role of the OMAC to ENT gray area maxillofacial, cosmetic and facial plastic reconstructive, let me show you a slide walk through the facility. Brian's area. The outpatient clinic. Of course, we have a surgical speech lab and video teleconferencing. We have 3 operating rooms in the facility. And of course, we also have the prestigious room, library. And we have a scenic elevator, direct access from the ground floor to this 3rd floor. And our machine for the medical additive printing. So there were some conferences or workshops that have been conducted in the center. The CMFS Masterclass 2014, earliest that. So it's the Otolaryngologic Maxillofacial Aesthetic Center. The people who are behind in trying to develop our specialty for the society. Well, for the Philippine Academy in the past, the present, and the future, as the present state, and may I end my abridged perspective of the past of the Philippine Academy of Craniomaxillofacial Surgery by saying that as the present stands on the past, it has to really understand the wisdom and noble intentions of the past for it to be supported by a sturdy foundation that makes the present forge with the past to hold and sustain the challenges and heavy innovations of the future. Let me show you just with your kind indulgence, a 2 minutes video of the courtesy of the President, Dr. Gutierrez. Ladies and gentlemen, colleagues, that ends the presentation. Thank you very much. Stay safe and God bless us all.